We only get one chance to get a person's death right. People with learning disabilities have an equal right to a good death, and we hope by making conversations and planning more normalised, we can help everyone within the wider health and social care sector to get end-of-life care right. Talking about death and dying is difficult for most of us, but historically, it's been a huge barrier for people with learning disabilities. Many people with a learning disability are not being involved in conversations about their end-of-life care, what dying means, or having the opportunities to make their own decisions regarding their death. Evidence indicates that many people with a learning disability experience inequalities in this area of care. For many, they're more likely to die at a younger age than the overall population, and secondly, they sometimes experience poor palliative and end-of-life care, with their individual needs often overlooked. For some people with learning disabilities and their carers, these challenges can result in poor outcomes at a time of profound distress and grief. Advanced care planning is a way to think about and discuss personal wishes for future care and end of life. Planning ensures that if a person is unable to make their own decisions, that healthcare professionals understand what is important to them and can offer reassurance that the right decisions will be made. An advanced care plan is not a legally binding document, and it can be changed at any time. It includes how people would like to be cared for at the end of their life and what healthcare professionals should know about them. It can take a long time to gather information for a person's end-of-life plans, and they may never be completed, but any information can help health and social care staff support a person with a learning disability more effectively. There are some important things to be considered when supporting someone who has a learning disability to discuss end-of-life care and advanced care planning. It does not have to be completed in one conversation. Often it's far more effective to have such discussions over a series of time. We need to document advanced care planning discussions to make sure that all the key people involved in that person's care can access this information. And we should be encouraging conversations to include family members, friends, and carers. We should always consider reasonable adjustments for the person. Do they need easy read information, pictures, or information to be provided in a different format? A good way to initiate discussions about advanced care planning is to use a tool like this, which means that you can sit with someone and work through the process at their pace. The benefit of using this method is that it can be done anywhere, that the person is going to feel comfortable to talk about death and dying. The process is simple and starts by placing the person right at the centre. There is a range of things they can choose from that they might consider as important when planning for the end of their life. They start by picking what is important to them and placing that around the image of the person. They continue to pick things that are important until the first stage is complete. Those things that are still important for them, but less so than the immediate ones, will then go around, and you continue to build until the person has included everything that they feel is important for them to make a personalised end-of-life plan. If we do not have images for something, then the person can either draw something on a blank template, or we can find an image to include. Having a simple visual guide that the person has been involved in gives them ownership and control, and means that as a carer, you know the plan will contain what is important to that person. There are different ways to use that as a plan. You could either take a photo of the plan or transfer their wishes into a formal document, so this can then be shared with key people involved in that person's care. It's never too early to plan ahead. We should start these conversations as soon as possible and reach out to involved professionals to support the process. Excellent communication skills are a key and vital component to advanced care planning. You should be both confident and competent in talking about end-of-life matters and having these valuable and meaningful conversations at the right time. You can use your local palliative care teams or contact your local hospices to ask for support and guidance. In primary care, the gold standards framework is used. This is also referred to as a GSF and is a model for a planned system of care that involves 3 overarching steps to identify, assess and plan. Using the gold standards framework enables good practice and better coordination of services between healthcare professionals. It's available to all people in the last years of life and aims to provide a gold standard level of care, prevent unplanned hospital admissions and enable people to live well until they die. There's lots of helpful information available about advanced care plans and end-of-life care that you can find online.